Now we're live. What is up, Chelsea? How are you?
Hi, I'm good.
Good.
Welcome to LaserAway Live, everybody. I'm here with Dr. Kirby in Beverly Hills.
What is up? Robertson Boulevard. Come see us anytime. This used to be just a training facility, and now people can come in and actually get treatments here because it became so popular that we had to move our corporate office. So these are good problems to have.
And we have 2 in Beverly Hills now. It's pretty awesome.
That is awesome.
Yeah.
And you know what people love in Beverly Hills? Gorgeous lips. And that's what we're talking about today.
Beautiful segue.
What's your plan?
So we're going to be doing a lip augmentation on this beautiful model. Say hello. Hi. She already has really beautiful lips, so what we're going to be doing is we're just going to accentuate her natural beauty, give her a little bit more. What we're looking for with lips is a 1 to 1.6 ratio in between the top lip and the bottom lip. So I'll be accentuating her top lip and then using a little bit more product to balance it out with the bottom.
I'm so glad you brought that up. One of the common mistakes we see with novice injectors or people who don't know what they're doing with lips is they will put an equal amount. So they'll put, the ratio will approximate a 1 to 1 ratio. And when you do that, the upper lip will look great, the lower lip will look great, but you can't look at just them as isolated things. You can't look at them in a vacuum. You have to look at them in a clinical setting. And it's that ratio that's of paramount importance. When we talk about lips, cosmetic distance is 4 to 7 feet away. So we're a little closer to her right now than 4 to 7 feet away, but most of the conversations you have in your lifetime are 4 to 7 feet away, and that's where you really have to think of how your lips look. So if you're at home and you're thinking, hey, should I get lip augmentation? Don't think of yourself looking in the mirror sitting on the edge of the sink, and definitely don't use a magnifying mirror. Take a step back, think of 4 to 7 feet away, and that's how we ideally want to judge anything in aesthetic dermatology, but lips in particular, so that you can get that ratio. And what is the ratio again, Chelsea?
So 1 to 1.6.
Upper lip, you want a 1, that ratio is 1 to 1.6. You always want more volume in the lower lips. Patients come in all the time and they say, I love my lower lip, I want more volume up top. And maybe they need that, but still take a step back and look at that ratio. Almost always, they need more in the bottom than they need in the top.
Absolutely. All about
Does that make sense?
Yeah, it does.
creating the perfect lip.
Now she has beautiful lips to start with, which again makes an injector's job so easy because all we're doing is augmenting what Mother Nature gave you. People say, I wouldn't want lip augmentation because I don't want to look artificial. When it is done appropriately and conservatively, no one can tell, and it looks absolutely gorgeous.
That's another really great thing about LaserAway. We like to do our lip augmentations in a 2-step process so that you can kind of get a feel for it, and then you come back about 2 weeks later and decide if you need a little bit more or anything like that. There's no necessary thing to use a whole syringe in one day. We want to create the most natural look for you.
Absolutely, I think that's so important. No one can ever fault you for having a conservative, appropriate, beautiful, natural look.
Speaking of which, I guess I'll get started.
Let's do it.
Yeah.
So she's numbed up. She's been wearing numbing cream. It's a combination numbing cream. It has 3 different types of canes in it, which are anesthetics. And so your lips look totally normal, but to you they probably feel really numb.
Super weird.
Yeah, it feels a little bit weird. And people sometimes think they're drooling.
Yeah.
They feel like they're slurring their speech, and they're not. It just that's how strong the cream is. So we put that cream on for 15 to 30 minutes ahead of time. Then we cleanse with a little bit of isopropyl alcohol, and then we get started. Oh, we have some questions. Or do we have questions? We're getting questions. If you have questions, you can ask your question and I will answer it live. But I also, as we discuss things and as Chelsea implements lip augmentation, I'm going to sort of narrate it so she can kind of focus on what she does. So we always want to cleanse the lip with isopropyl alcohol to get started. One of my pet peeves in life, this is more of my resident medical student and intern pet peeve, is when someone will chart afterwards in the electronic medical record and they will write, cleanse the lips with ETOH. ETOH is ethanol. Call me a nerd, but there's a huge difference between ethanol and isopropyl alcohol. This is isopropyl alcohol, bacteriostatic, bactericidal. And in my career of injecting lips, which is now, I've been injecting lips for 14 years, I've never once seen a bacterial infection in the lips. So can it occur? It could, but typically it's prevented by just using a little bit of isopropyl alcohol.
Gosh, she has beautiful lips.
Again, her ratio is great, so it makes Chelsea's job very easy.
So easy. All right, we're going to get started with a little pinch right here on the Cupid's bow.
So the Cupid's bow is the top where the vermilion border defines the mucosal side of the skin from the dry side of the skin. And the Cupid's bow is really where where femininity is defined. Because when you have a little kissable, beautiful Cupid's bow, that's when people really notice lips, particularly in pictures. And we do live in an Instagram age. So when you have those lips that look great on camera, well, they look great in real life too.
This is real filming. You guys are gonna see some blood today.
So 100% normal to have a little bit of bruising, swelling with lip augmentation, particularly in the mid-level areas because that's where the lip is most vascular.
One, two,
Just a couple little
three,
pinch on 3. 1, 2, 3. So this product that Chelsea's using here is called Juvederm Ultra, and people say all the time, I want to get lip augmentation in my. Am I good here, Bobby? I don't know. To back up. He's telling me. Okay. People say I want to get my lips augmented, and what should I use? And I tell them that 78 to 82% of all filler in the United States is done with Juvederm family of products. There are other options. Bolotero is another option. Restylane another option, but the vast majority of lip augmentation is with Juvederm family of products. Now, with Juvederm, there's 5 types of Juvederm, and this is where it gets very confusing. There is not one single type of Juvederm, there's 5 types of Juvederm. I think that the names of the Juvederm family of products, little tiny pinch there, and she's doing a slow retrograde injection just to get a nice little augmentation. And massaging and molding is an imperative part of any type of lip augmentation procedure. So 5 types of Juvederm products. Volbella is the least viscous. Then there's Juvederm Ultra, Juvederm Ultra Plus, Volair, and Voluma. So there's 5 types of products. There is no one single Juvederm product. This is Juvederm Ultra XC, which is what almost all lip augmentation in the United States is done with.
So Dr. Kirby, what's the difference between Ultra Plus and Ultra XC? We get a lot of those questions.
Great question. So, well, the XC just means it's infused with lidocaine. So now every single product in the Juvederm family is infused with lidocaine. So let's put the XC aside because they all have XC. Okay. So there's Juvederm Ultra and Juvederm Ultra Plus. Again, there is no Juvederm per se. So the difference between the Ultra and the Ultra Plus is a difference, you can think of it in a difference of viscosity. So the thicker product is going to last a little longer, but it's a little bit harder and it has a lot more swelling. So Juvederm Ultra Plus is typically used for nasal labial lines, where Juvederm Ultra is typically used for the lips. And then people say, what is Juvederm? Well, Juvederm is hyaluronic acid. Hyaluronic acid is a naturally occurring substance. It's clear, it's gelatinous, it's in our body, it's in our skin. It coats the ends of our bones, our hip joints, things like that. So people say, well, I would never put something unnatural in my body. It's actually extremely natural. It's a synthetic derivative of a normal, very common product that is all over our body. It's ubiquitous. And then it's metabolized naturally over time. So maybe 10 years ago, people were relegated to using one of 2 products, which was collagen, which people loved, and it was soft and kissable, but it went away very quickly. It just dissipated so quickly that no one wanted it. It only lasts about 2 to 4 weeks. And the other product was silicone, which is a terrible idea because it is permanent, and the way that you get augmentation with silicone is you get a granuloma around it. So look at that, how beautiful that is. Very subtle, a little bit of redness, a little bit of swelling, but those of you at home watching, those of us in this room can see it, but it's very natural. Now, with lip augmentation, we want to fill to 110%. And what that means is she needs to leave the clinic here today 10% bigger than she ultimately wants to look. And if she walks out of these doors and she's a little bit bigger than she wanted, then we've done our job well. Why? She's going to get swelling. What's that swelling from? Well, part of it is just from the implementation of the filler itself. If Chelsea took an empty needle and stuck it in the lips 15, 20, 30 times, you're going to get some swelling. And that is transient. That's going to go away on its own in a few days. Some of the swelling is obviously from the product itself, which is normal. That's what we're trying to do is augment. And then some of it is from the numbing cream. So we got a question here. Can you get filled, so someone just asked, can they get lip augmentation while they are pregnant? And the answer to that is, you should not. It's never been tested, and it never will be tested. Under no circumstance are we ever going to do a double-blinded or a cohort study or a retro study where we look at charts and see what happens with people who got filler during pregnancy. I think it's 100% normal. There's no mechanism of action that would worry us at all, but out of an abundance of caution, we don't do it during pregnancy. And again, why would we need to? Just enjoy the pregnancy process. You may get some vascularization of your lips on their own during pregnancy. Women often talk about that healthy glow, and then that's normal. And then after you're done breastfeeding, then you could consider getting lip augmentation. We have another question. How soon before my big event should I get fillers? This is so important.
The most important.
All the time people come in and they're like, oh, my high school reunion's this Friday, what's up? And or like getting married next week, it's the big day. And I tell people after lip augmentation, the healing time is typically 4 to 7 days. Now it may look great immediately, but bruising is 100% normal. We talked about swelling is 100% normal. So when should you do lip augmentation? Bare minimum in my mind is really 3 weeks. Because it can take 7 days, swelling, bruising to resolve. And like Chelsea said at the beginning, you may, she's measuring up right here because she wants to get her angles perfect for lip augmentation. But like Chelsea said, we often recommend that lip augmentation take place as a 2-step process. It's really important to have natural lips, beautiful lips. We get requests every day for people who want huge lips, and there's often a regional component to this too. Sometimes in Orange County, not saying they're cheesy, just saying that sometimes in Orange County they want really big lips. Beverly Hills too. Here in Beverly Hills, sometimes people want really, really big lips. But most people want really, really natural, small lips, and they want no one to be able to tell. So conservatism always wins out. With lip augmentation, when you're really, really conservative, that's the absolute best thing you can do. Just like anything in life, you don't have to jump in with both feet. First, dip your toe in the water, in our metaphorical water here, see if you like the temperature, and then we will save the rest of your syringe and you can come back. I've said a lot, but let me keep going because I just can't. I wish this was Facebook Live. I wish I was just recording my life all the time because there's so much to say. So with this is this patient's syringe. It's hers and no one else's. So we open it in front of the patient. We show her that it's hers, and we store it for her to come back for the second portion of her lip augmentation. Whenever you go anywhere in the world, if you're watching this and you're not near a LaserAway and you're considering lip augmentation, tell the practitioner, I want to see you open the syringe in front of me, and I want it labeled for me, and I want to see that it's a full syringe, because there are some unscrupulous places that will give you a portion of a syringe. They'll give you someone else's leftover. They'll use half of your syringe and sell it to someone else. That is your syringe alone. Ethically and from a safety perspective, it's no one's but our patient. And if she doesn't use it, well, then we put it in the sharps container and it gets incinerated. So it's very important that we know what we're looking at with lip augmentation. So how much did you use of the syringe?
I've only done this side so far, so I was hoping
we'll
Dr. Kirby we could
places.
switch sides.
Yeah, let's
absolutely. But as of right now, with half, I've used about 30% of the syringe.
Great. So let's go. We're going to switch sides. Here, I'm going to walk right around. Hope I won't trip. Which way do you want to go, Chelsea?
I'll come this way too. Excuse me.
Got our new sound mixing board, those little wire things. How are you feeling? How are you doing so far?
I'm doing good.
Feels good,
Yeah,
right?
yeah,
So let's do a quick sort of right and left augmentation. Look how beautiful her vermilion border looks. The vermilion border is that line that defines the dry mucosal, this dry side of the lip from the wet mucosal side of the lip. You can see that it's augmented. You can absolutely see, I mean, a picture's worth 1,000 words. Look at that. It's a little bit more kissable. It's a little more bold. Still incredibly, incredibly natural. She has very minimal swelling, minimal bruising. Really, really nice, pretty natural result. And Chelsea purposely did have so that we can compare. And I'm asking myself, what am I looking for here? Ratio looks great. You want more volume in the lower lip than in the upper lip. Cupid's bow looks gorgeous. Vermilion border looks gorgeous. Look at her angles. It's got that nice, effeminate slope. I'm very pleased, and I'm sure she's going to be pleased when we're done.
All right, let's get started. We're going to start again on the Cupid's bow right here. We are going to have that little pinch. These tend to be the pinchiest. Why is that, Dr. Kirby?
Curl your toes real tight, little pinch on 3.
1, 2, 3.
Well, there just happens to be more nerve centers in that midline area. So when we talk about that middle portion of the lip, it just happens to be an area that's more technical from an anatomical perspective. Down below, the lip augmentation is a lot less uncomfortable. It's still uncomfortable, but it's a lot better tolerated for the lower lip. Benjamin, we have more questions there. Can I tell you some common questions we get with lip augmentation?
Corey wants to know what other type of treatments you can get at LaserAway.
Oh, well, I mean, we're the nation's leading aesthetic dermatology provider. So we do a lot of facial skin rejuvenation, which may be something like a skin firming, tightening via thermage, which is radio frequency. We offer IPL, which is intense pulse light. It helps with browns and red discoloration of the skin. Fire and Ice laser facial, which is a great way to maintain beautiful skin. And we do body treatments as well. We do tons of cool sculpting as well as VelaShape, which is a cellulite treatment. So lots of different treatments here at LaserAway. Today, Corey, we're focusing on lip augmentation, which is one of my favorite treatments. You're going to see more and more lip augmentation in the news. It's becoming so prevalent these days. Now, lip augmentation is not without side effects. Every single person who comes in needs to understand, what are they going to experience? Swelling. 100% of the time you're going to get swelling. That is just known. It's not even a side effect, it's a known entity. You're going to get bruising. Well, why wouldn't you get bruising? Of course, we're doing injections, so you're going to bruise. And when you bruise, it can be a pinprick bruise, it can be multiple pinprick sized bruises, or it can be as big as a dime on occasion. And if that occurs, you just cover it with makeup. With the first 24 hours after lip augmentation, we just apply Vaseline, and there's really no instructions other than a little bit of light massage on the patient's part. We're going to talk about that more in a second. And then after 24 hours, there's no real restrictions. The patients are welcome to use lip gloss, lipstick, anything they like.
Please go shopping.
The problem is the lips look beautiful right away, and then people want to use lipstick, and I'm like, let's just wait for a little while first. Wait that 24 hours. It's a critical period.
Yeah, we definitely don't want you pressing down on your lips at all.
So with lip augmentation, it's a partnership, and we're going to do our part very well, which is choosing the right product, choosing the right amount of product, knowing our anatomical boundaries, correct implementation. But when the patient leaves, they have a job to do as well, and that job is massaging and molding, M&M. M&M is an imperative part of lip augmentation. It's actually a fun part of lip augmentation. We tell every patient, look in the mirror 4 to 7 feet away, and then you massage your lips the way you want them to look. And what does that mean? Let's get real tangible here. You want to massage that vermilion border, that line between the wet mucosal side of the lip and the dry side of the lip. Massage the Cupid's bow, which is where the little downturn right in the center of the lip. You want to massage, in general, just the upper lip and lower lip in a medial direction, meaning the midline of your face. And when you do that appropriately, it's going to make the Juvederm very smooth and soft. It makes the implementation and the entire process go a lot better. Now, she's an incredibly stoic patient, doing a wonderful job. Her lips they look great already.
It too easy.
She makes it look really easy because it is uncomfortable. Part of she used her numbing cream, but the product again, this is called Juvederm Ultra XC. The XC means it's infused with lidocaine, so each pinch hurts, but once the product is in there, it's very, very tolerable. Let's do a quick recap because I know you guys are on the edge of your seat. Lip augmentation, here's Chelsea implementing it. First thing she said was she wants the correct ratio, and I love that idea. You always want more volume in the lower lip than in the upper lip. Novice injector mistake, or someone who doesn't know what they're doing, puts the same amount. And if you ever see a ratio of lip ratio of 1 to 1, you can see from a mile away it looks very artificial. Your brain can't tell why, because the upper lip looks beautiful and the lower lip looks beautiful, but when you look at them together, it's a 1 to 1 ratio, and that is incorrect for human lips. It should really be more of a 1 to 1.6 ratio. That's kind of a ratio, the golden ratio that we deem to be the most beautiful. So Chelsea's looking at that right now. She wants to make sure the right and the left side matches, and she may have a different amount of swelling. It's very normal to have asymmetry after lip augmentation because you can have more swelling on one side than the other, and that's why she's doing a really good job making sure she's using the appropriate amount. She's doing M&M, her massage and molding. Our patient's being really stoic. She's so comfortable she fell asleep, which is good.
This is super important. It's a little uncomfortable. A good massage should be uncomfortable, right, Dr. Kirby?
Yeah, you don't want to bruise the person. You don't want to massage so hard that you're bruising it, but you really work. There's a number of different techniques to do any type of filler injection. You can do serial puncture. You can lay down little tracks. You can do cross hatching. And ultimately, it's important that you gently massage that in. Lips are very, very vascular. They bleed very easily. They bruise very easily, but they heal very easily. So that's the good news.
You can kind of see a couple of them in there too, the little bruises.
And that's very normal. And
Very
it's not always
normal.
normal. It's anticipated, expected. It's welcomed. It's encouraged. It's part of the process. Chelsea's going to get an A+ for massaging here. She is just doing, this is like free lip massage. Well, we don't really offer lip massage as a service other than it comes free with this treatment. Oh, we have a question.
Have to pay extra.
It says, can I get filler in just my top lip? Yeah, filler is based on an implant. The assessment is an individual patient-specific situation. So maybe someone does have just a thin top lip, and we want to get that ratio correct. Typically, people need filler in the upper lip and the lower lip because it all comes down to that ratio. I have rarely in my career seen someone who has an extremely full lower lip and a very thin upper lip, and then they will get a little bit of filler up top. But I also see people with asymmetry, just natural asymmetry, people who have had trauma, dog bite, things like that, in which case we will do one side a little bit more than the other to get it really balanced because the human eye loves symmetry.
What do you think, Dr. Kirby?
Let's take a peek. So, where's a mirror?
I know.
What does my opinion matter? Do we have a mirror? We don't have Benjamin Hansen mirror, would you? We should have been prepared. I think while we're looking for the mirror, I think they look absolutely gorgeous. We want to grab a mirror. Benjamin's going to grab a mirror, and then we want to get your opinion. Chelsea, will you wipe that one little spot there on this side? I just want you to see it. Little tiny injection point.
Let me see a little alcohol. Oh, you know what? Excuse me, Dr.
Oh,
There's fresh alcohol right here.
I think they look absolutely gorgeous. And let's talk about from an anatomical perspective, why do they look so good? Vermilion border's been augmented. Come on in.
Oh, no,
sorry guys, sorry, I heard something.
Corey's
in the
here
mirror.
too. Corey's getting,
Hi.
Corey's
How's it
insecure because she
going?
wants to film. So let's take a look.
Oh yeah. That
So
looks awesome.
now hold it out as far as you can if you would, and this is really important. I like people to hold it out as far as they can.
Yeah.
Even that's, you know, not quite 4 to 7
That looks
feet
great.
obviously, but you're gonna have 10% more swelling right now than you will in a couple days. It's gonna look a little more natural in the next couple days. Ratio looks gorgeous, not much bruising in the scheme of things. Very, very natural. If someone met you on the street in a couple days, it's gonna look beautiful. I'm extremely pleased overall. How do you feel about it,
I
Chelsea?
love them. I
Yeah.
wish they were mine.
They look beautiful, and from this angle, they look really, really good too. They're like kind of pouting from the side.
Can we just emphasize that for a second?
Let's
So
do it.
you can only look at yourself one way in the mirror. This is really important for people at home to understand. You can only look at yourself straight on unless you're going to either film yourself or set up a series of mirrors. So it's really important to remember that the lips are a three-dimensional object, and the injector can see it from a different angle or from a completely lateral angle, and that's where lips have to look good. Anyone can look good straight on, but this day of Instagram, boomerang, things where you're seeing, Instagram TV, you're seeing things moving, and I want to get Facebook mad at me, Facebook too, that you need to be able to see it from all sides. This is a three-dimensional, 360-degree process, and so they look great from the side too,
Yeah,
which is
they look
really
awesome.
important.
So cute. Love it.
How was your experience? I know it was uncomfortable,
No,
but
it was
tolerable,
great.
right?
Like, yeah, there was a little pinching, but it was tolerable, and yeah, I'm so happy with the results. Thank
And then
you.
Chelsea, how much of her syringe is remaining?
So we have about 30% of your syringe left.
Okay.
So they're about 10% bigger than they are going to be. You're going to
Okay.
lose about 10%. And then
Okay.
if you decide you want to do a little bit more, you're more than welcome to. I always like to let people know though that just because don't get stuck on a number.
Okay.
Like when I
Yes.
like when I treat, I never use a full syringe, and it just is what it is. You
No.
know, you want a good augmentation.
People typically don't need a full syringe. We go anywhere from an incredibly conservative treatment would be a third of a syringe. Very often we'll do half a syringe, 2/3 of a syringe if someone has a little bit genetically thin lips or they're younger, they can tolerate it. Very, very rarely does someone need an entire syringe at once. If you go anywhere in the world and they're like, you need 2 syringes, you should walk out of the door because they're trying to oversell you syringes, and number 2, they may be using a half syringe that they used on someone else and they're going to give you 2 halves. So my common sense caution advice to anyone out there for lip augmentation, almost all lip augmentation is done with Juvederm family of products. There is not Juvederm. There's 5 types of Juvederm. Juvederm Ultra Plus is 78 to 82% of all lip augmentation in the United States. And you want to see your syringe, you want to see it open in front of you, you want to make sure your ratio is 1 to 1.6, and you want to go to a place like LaserAway that just has a massive amount of experience. I don't think that there's any group in the United States that does more lip augmentation than we do, and we have a great reputation for it because we're conservative and because we're very good at it.
Bam.
Well, hey, if you want to schedule a consultation, you're more than welcome to click the link underneath, and we'll see you next time.
We'll
Thanks
see you
so
at the
much.
Botox party.
Yeah.
Botox!
Oh,
That's
yeah.
the Botox party.
Botox party, October 27th.
27th, I
No,
think?
Thursday.
Thursday.
The 25th.
25th.
October 25th.
Yeah.
It's a big one.
It's a big one.
It's our
Google it.
best sale of the year.
$1,000 raffles.
Every
Not on
clinic.
Juvederm.
I think there's 47 LaserAway clinics, or is it
I
45?
think it's 46.
46. All right, I don't even know.
Right in
We
between.
don't know when Boo Fest is. We don't know how many clinics there are, but we're really good at what we do. Other than that, I
We'll
promise.
see you soon.
We're great with the Jew. All right, bye,
Bye, guys.
Thank you so much.
Like that video? Make sure to subscribe to our channel by clicking left. And for more awesome videos, click right. And to schedule your free consultation for any of our services, click the on-screen link. What are you waiting for?